So towards the end of my mom's journey, she was at the point where she was trying immunotherapies and they weren't working. So we quickly learned that that's usually the point where things are going to get tough because you run out of options. That's the time that I learned that there's hardly ever any treatments for brain cancer. Um, and my mom was kind of past the point, unfortunately, of doing clinical trials or going to see other doctors. And that was around October of 2016. And I had just had a huge work event that I was in Kansas City, but I was out of my house for 5 days working constantly. Um, and then my stepdad had said, "Hey, my mom isn't doing very well. I'm going to take her to the hospital just for a checkup and see what's going on." And at that point, she had already stopped immunotherapy, so we kind of knew, it wasn't going to be the best results. And so what they did is they actually admitted her to the hospital because it was quicker to get an MRI that way versus having to wait. And so that was the beginning of November of that year. And we she had the MRI, and we spoke with the neurosurgeons because we didn't know if surgery was an option. And, we talked with the neurosurgeon and his team in depth about that. And it was something I think that we possibly wanted to try. But after the explanation of, once they go in and take it out, it leaves it, more room for it to go back again. It's just kind of that never ending cycle. And at that point, it was, I'd say, at least 3/4 of her brain after seeing that MRI. So the neurosurgeon, talked to us and said, "Hey, unfortunately, surgery is not an option." So the neuro-oncologist then came in and, we kind of went through all the checks of what we've done so far, what anything else he recommends. And unfortunately, at that point, he did not have anything that he recommended or could even, give my mom, because that's just the amount of treatments are out there. She did all of them and had issues with certain ones. So obviously you can't go back to them. And so at that point, we knew what was going to happen. We just didn't know how we wanted it to happen. So at the hospital, they had part of their care team come in with their social work department and kind of come talk to us about what hospice is, what it looks like, how we can manage it the best way we want to. And at that point, it was mid-November. And so she had already been in the hospital for a good week and a half. And we were just trying to figure out all these decisions. And we were very open as a family. We weren't shy about what we felt. And we constantly told each other that this is a very serious thing, and we wanted to make sure that all of our thoughts and our wants were being respected. And we were all on the same page, and we chose not to have my mom at hospice at home. I know a lot of people will do that just because they want to make them comfortable and, at their house, somewhere familiar. And I totally understand that. But unfortunately, our house wasn't equipped for that. And it sounds bad, but I didn't want that to be the place where my mom passed, because I knew that that's what was going to happen. So we chose to have her at a local hospice facility in Lee Summit that was really great. We met with them a few times before we actually moved her there, and just to make sure that that was the right fit, because that's something that you never learn about. You shouldn't have to learn about when you're in a situation like this. But thankfully the social work team at the hospital was good enough to set up interviews with multiple facilities, and we visited the multiple facilities and made sure that that was where we wanted her, and plus it was the closest one to home, so we were still able to stay the night at our house and be at our home, even though we were mainly there most of the time.